Hi guys, good morning everyone. So shall we start the conjunctiva quiz discussion? So last evening we started the new schedule of our daily 6 p.m. quiz and it was conjunctiva yesterday. So we'll start with the discussion right away without further delay. So what was the first question? One second. Alright. The first question was cobblestone appearance of the conjunctiva is seen in. Cobblestone appearance. What is the other name for cobblestone appearance of conjunctiva? It's also known as pavement stone appearance, because you see in certain countries, not really in India, where most of the pavements or the streets are with cobblestones, not like ours. Ours is like smooth, no, leave the potholes. Otherwise it's smooth. So it has these pebbles, huge pebbles. So why is that? So that is why it's called cobblestone appearance. So why is that kind of an appearance we see on the conjunctiva, typically on the palpebral conjunctiva? So if you're going to evert the lid, you will see the cobblestone or the pavement stone appearance. So that is because of the presence of papillae. Okay, that's because of the presence of papillae. So cobblestone appearance of the conjunctiva is seen in which condition? See, even without options you must be able to say, but anyway let me read out the options for you. Option A, angular conjunctivitis. Option B, trachoma. Option C, spring catarrh. Option D, granulomatous conjunctivitis. What is the option, Pasangla? Tell me. Angular conjunctivitis, trachoma, spring catarrh, granulomatous conjunctivitis. In which of the following options do you get to see cobblestone appearance, also known as pavement stone appearance of the conjunctiva? And which part of the conjunctiva do you get to see this appearance? You'll see it on the palpebral conjunctiva. So that means you're going to flip the eyelid, and when you see the palpebral conjunctiva, typically in the upper palpebral conjunctiva. So that is seen in which condition? It is seen option A, angular conjunctivitis. Option B, trachoma. Option C, spring catarrh. Option D, granulomatous conjunctivitis. It is seen in spring catarrh. Okay, that is your vernal keratoconjunctivitis. You've got these papillae. It could be smaller papillae or giant papillae, which gives the appearance of cobblestone or pavement stone appearance. Very, very important. Okay. Now let's move on to the next question. Herbert's pits are seen on. We are not asking about in which condition, because you all know it is seen in which condition Herbert's pits are seen by bache? Herbert's pits are seen in which condition? And then we'll move on to the actual question where I've asked where it is seen. It is seen on. So Herbert's pits are seen in trachoma. Okay, it is the healed Herbert's follicles which are seen in trachoma. Now, in where is it seen? Which part of the eye do you see it? Option A, limbus. Option B, palpebral conjunctiva. Option C, fornix. Option D, lid margin. I repeat, where do you find the Herbert's pits? Option A, limbus. Option B, palpebral conjunctiva. Option C, fornix. Option D, lid margin. Where do you find the Herbert's pits? See, where do you find your Herbert's follicles? Herbert's follicles, I've told you, they are found on the bulbar conjunctiva, typically at the limbus. Yeah, bulbar conjunctiva, where it ends at the limbus, that is where you get the limbal follicles. Yeah, so obviously you will find Herbert's pits also there. So I was actually looking for bulbar conjunctiva, but in the option there is no bulbar conjunctiva. Yeah, because Herbert's follicles typically seen, we say, in the bulbar conjunctiva, right? Bulbar conjunctiva at the region of the limbus. But I don't find bulbar conjunctiva. So let's see what is the closest option. Limbus, palpebral conjunctiva, fornix, lid margin. See, palpebral conjunctiva also I will see follicles, but that is not called Herbert's follicles. Okay, so definitely when those follicles heal, they are not going to leave behind Herbert's pits. So the closest option or the most specific option is limbus. Herbert's pits are seen in trachoma at or on the limbus. Is that clear to everyone? Yeah. So where do you find, which condition do you find Herbert's pits? You find it in trachoma. Okay, Herbert's T, trachoma, and where? Bulbar conjunctiva at the limbus, close to the limbus. So here we don't have bulbar conjunctiva, so the best option would be limbus. Is that clear? So I am moving on to the next question. Flictinular conjunctivitis is due to. Okay, let's see what are the options. Allergy to exogenous protein or exogenous allergen. Allergy to an exogenous protein is a spring catarrh or vernal keratoconjunctivitis, not flictenula. What is option B? Allergy to endogenous protein. Exactly, that is what is flictenula conjunctivitis. It is an allergy. It is a delayed type hypersensitivity to an endogenous protein or an endogenous allergen. Yes, that is our answer. Pseudomonas pyocyanin. No, it's not at all an infective condition. It can get infected later, but as of now, it's not infectious in origin. Okay, it's basically a hypersensitivity. All right. Pneumococcus, no, nothing to do with flictenula keratoconjunctivitis. Okay, I'll tell you that later. Okay, let's finish the quiz. Okay. The treatment of angular conjunctivitis. See, first of all, what is angular conjunctivitis? Angular conjunctivitis when you have redness only at the corners of the eye, only at the medial canthus and the lateral canthus. Yeah. And what is it due to? It is due to Moraxella lacunata, that bacillus, diplobacillus. What are the answers? The treatment of angular conjunctivitis. Option A, oxytetracycline ointment. Yes, correct. But if you were to choose option A, what happens? Because now when I read option B, zinc oxide skin lotion is there. That also is an answer. Now I proceed to read option C and bang, I see them both A and B, both. So whenever I always keep telling you, see, your actual exam may not be as, or your examiner may not be as devious in mind like me, but can be, may turn out to be. So you need to be careful. So that's why I always tell you, whenever you get your correct answer in option A, always read option B, C, D. Yeah. All right. So oxytetracycline, yes, to neutralize the organism, tackle the organism. Zinc oxide is to neutralize the proteolytic enzyme that is secreted by the organism that is causing all this itching, the lid maceration and everything, no? So you need to give both. So the answer is C, correct? Get it? So although even if you mark either option A or option B, you might be right, but there is the best option, which is option C, which says both A and B. So please read all the options, all right? And also there was just none of the above, and thankfully none of you went for that. All right, well, let's move to the next question. Mucopurulent discharge is seen in. Muco means there's some mucoid, there's a sticky component, and purulent, there's a little pus component, is seen in chemical conjunctivitis. See, chemical conjunctivitis, it's like a serous discharge. It's a watery discharge. Yeah, the irritation, it's just the irritation. So you'll have a watery discharge in chemical conjunctivitis. Yeah. So chemical conjunctivitis typically seen in a newborn on the day of birth, or it can even happen to any of us. You're exposed to some fumes, you're exposed to some, or even if you clean your bathroom, so much of acid fumes. That day you might get this, or you put the Dranex into your drain and you used to stand around without, moving out. You can get a chemical conjunctivitis. That day you'll be just tearing. So that means what? It's only a serous discharge or a watery discharge. Okay, so it's not a mucopurulent discharge because it's a sterile conjunctivitis. Allergic conjunctivitis, you have a mucoid component. You don't have a mucopurulent. Where is the pus coming from? No organism, no infection as such to cause a purulent component in the discharge. So mucoid component. So no. Viral conjunctivitis, again, it's just watery discharge, watery. You're tearing all the time. Chlamydial conjunctivitis, yes, very typically chlamydial conjunctivitis will cause the mucopurulent discharge. Is that clear to everyone? So today we've learned watery discharge in chemical conjunctivitis and viral. Okay, so viral and chemical, you get the watery discharge or the serous discharge, mucoid discharge in allergic. An extreme variant of that mucoid is your stringy or ropey discharge, which you typically get in vernal keratoconjunctivitis or spring catarrh. All right. Now, mucopurulent you will get in chlamydial, although on all non-specific, all bacterial also you can get mucopurulent. Yeah. Okay. Next question. Complication bracket S. Complication or complications of trachoma. Symblepharon. See, whenever you got these inflammations of the conjunctiva, you do this intense inflammation stage and all, no, where you see the reddish, velvety red, like your velvet red cake, like that. You got a palpebral conjunctiva, you got a lot of raw surfaces. Yeah, so in that case you can get symblepharon. Yes, you can get symblepharon as a complication of trachoma. Yeah. Corneal opacity, yes, O is the last of that fistostaging, FISTO. O stands for corneal opacity. So you can get various grades of corneal opacity. You can either get a nebula or a macula. You can even get a leucoma, yeah, because your trichytic lashes are rubbing on the cornea. You're getting corneal ulcer and epithelial defects healed, and then you get corneal opacity. So yes, that is there. Symblepharon is there. Corneal opacity is there. Trichiasis, yes, definitely. Why do we get trichiasis? Because of the entropion, the inward turning of the lid margin. Typically, it affects the trachoma, affects the upper lid. So, cicatricial entropion of the upper lid resulting in trichiasis of involving the upper lid lashes. So, these trichiatic lashes rub on the cornea, causing the corneal ulcers and the opacities. Yes. So, all of the above. Option D, all of the above. Yes, so symblepharon, that is addition of the palpebral and the bulbar conjunctiva, can also occur in trachoma. Okay, so all of the above. Is that clear? So can I get symblepharon in trachoma? Yes, you can get. And what is a symblepharon? Symblepharon is an addition, sticking of the bulbar conjunctiva and the palpebral conjunctiva, or I can say the eyeball to the eyelid. Okay, so that is symblepharon. It can occur. Trichiasis can occur. What is trichiasis? Misdirection of eyelashes. Yeah, misdirected eyelashes called trichiasis. Understood? In corneal opacity, part of your fistostaging, the O of fisto, WHO's fistostaging is corneal opacity. Is that clear? Yes. Alright, moving on to the next question. One of our examiner's favorite. Which of the following causes acute hemorrhagic conjunctivitis? AHC, acute hemorrhagic conjunctivitis, where the eye looks bloodshot, red, all that's nothing serious is going to come out of it. Haemophilus influenzae. Haemophilus influenzae causes a pink eye, but that is not what we call acute hemorrhagic conjunctivitis. Okay, it's not bloodshot red. It's kind of a little pinkish. Yes, there is reddishness, but it's not that like a subconjunctival hemorrhage or something like that. So not Haemophilus. Herpes simplex, not at all. Staphylococcus, no. Adenovirus, yes. Adenovirus serotype 11. Okay, serotype 11 can cause acute hemorrhagic conjunctivitis. Yes. So please put it in your brain box. Adenovirus serotype 11 can cause acute hemorrhagic conjunctivitis. What causes? And some of you who wanted to answer herpes simplex, you got confused with acute hemorrhagic uveitis. But again, acute hemorrhagic uveitis is not caused by herpes simplex. It is caused by varicella zoster. Yeah, it's caused by varicella zoster. Acute hemorrhagic conjunctivitis, a lot of viruses, including adenovirus serotype 11. Is that clear? Okay, let's move on to the next question. Inclusion conjunctivitis is caused by adult inclusion conjunctivitis, chlamydia. But I see there are two chlamydias. Chlamydia trachomatis, Chlamydia psittaci. And then herpes simplex. No, not herpes simplex, not gonococcus. Yeah. So between Chlamydia trachomatis and Chlamydia psittaci, Chlamydia trachomatis. Now, which serotypes cause inclusion conjunctivitis? So it is serotypes D to K, the one which causes the neonatal conjunctivitis, that serotype D to K. Okay, Chlamydia trachomatis D to K, that causes inclusion conjunctivitis, called as adult inclusion conjunctivitis. And your trachoma is caused by Chlamydia trachomatis only, but serotypes A, B and C. Okay, A, B, C for trachoma. For adult inclusion conjunctivitis or simply inclusion conjunctivitis, it's going to be D to K. Guys, thank you for your concern. I will address your concerns at the end. Let's finish the quiz because we've started the quiz again after a little bit of a hiatus. So let's finish off the questions and then I will be so grateful for your concerns. Next question. Topical sodium chromoglycate is used in the treatment of. What is You guys are perfect in pharmacology. You got great pharmacology teachers. So you should tell me now, what is sodium chromoglycate? You tell me what is the drug. What is a class of drug? Okay, what is the class of drug? Sodium chromoglycate. What is a class of drug? What is its mechanism of action? Yes, very good, Doc Wandra. Very good, beta. So, option A, flictanular conjunctivitis. See, flictanular conjunctivitis is a delayed type hypersensitivity. I would want to give steroids. It's not an IgE mediated. Yeah, IgE mediated means your mast cells are involved which are releasing histamine. Yeah, that is a pathology. Yeah. Very good, Doc Wandra. It's a mast cell stabilizer. Sodium chromoglycate is a mast cell stabilizer. Where do I want a mast cell stabilizer? Do I want it in flictanular conjunctivitis? No. The underlying pathology is not even type 1, not even IgE mediated. No histamine involved. No mast cells involved. So, no. Subconjunctival hemorrhage. Yeah, subconjunctival hemorrhage, whether you treat or not treat, it's going to get absorbed over a period of time. Okay, so you really don't want to give anything. But maybe in a few people, you want to avoid certain drugs. You want to avoid NSAIDs because it might promote a lot of more bleeding, or you want to avoid anticoagulants, things like that. That's all. You don't want to give anything in particular. Trachoma. Trachoma, is there a IgE component? Is the patient complaining of itching? No. Itching and rubbing of the eyes? No. So I don't want to give sodium chromoglycate. So what is left? Vernal keratoconjunctivitis. So your spring catarrh, also known as vernal keratoconjunctivitis, two hypersensitivities are involved. Primarily type 1 or IgE mediated. Okay. And also type 4. Primarily IgE. That is why there's so much of itching and the vigorous eye rubbing by the kid. So obviously I want to give mast cell stabilizer. Now you all heard of olopatadine, which is a drug of choice. Yes, because it's got this dual property of mast cell stabilizer also and an antihistaminic. It prevents the mast cell from releasing, and even whatever is released, it is going to neutralize. So it's a great drug, it's a drug of choice. But yes, I can also give sodium chromoglycate, no? Yeah, I can give that eye drops as well. So very good, Doc Wandra, appreciate. So the answer to this question, what is the question? Topical sodium chromoglycate is used in the treatment of, vernal keratoconjunctivitis. Is that clear to everyone? So please put it in your brain box. It's not just olopatadine that we give. We can also give such drugs. Yeah. All right. The histology of pterygium is option A, allostatic degeneration. Don't you think that is the answer? Yes, I do think, but I go by this thing in my mind. I always have this protocol. If I find the the answer in option A, I always proceed to read B, C, D so that I don't, leave out or, mark the wrong answer. Allostatic degeneration. Okay. Option B, squamous metaplasia of the epithelium. No, it's not a squamous metaplasia of the epithelium. Pterygium later may undergo a malignant transformation, but per se it is not. And squamous metaplasia of epithelium is basically a bite hot spots. Okay, so no. Precancerous changes, no, not necessarily. It's a very 1 in a million chance that it can become malignant. It can have a malignant transformation into a squamous cell carcinoma or a malignant melanoma. But that's a 1 in a million case. So not histology of pterygium. That's all. We're not talking about the outliers here. Epithelial inclusion bodies. What epithelial inclusion bodies? So what is our answer? Allostatic degeneration. So both your pinguicula and pterygium are allostatic degeneration of the conjunctiva and the subconjunctival tissues. Is that clear? Allostatic degeneration of the conjunctiva and the subconjunctival tissues. So that is both your pterygium and pinguicula, because pinguicula is considered as a precursor of pterygium. Okay, see, pterygium can occur on its own also, but sometimes pinguicula can transform into a pterygium. Yes, is that clear? All right, Dr. George and Dr. DDK. Okay, I'm okay. I'm not fully okay, but somehow I'm managing, guys. So yes, please do pray for me so that we continue the quiz every day. We don't have a break in between. And tomorrow, not tomorrow, today evening 6 p.m. we've got the cornea quiz at 6 p.m. Okay, so 10 questions, and those 10 questions, where do you find the quiz, ma'am? Okay, beta, at the end of the session, it's actually on my Telegram group. Every day 6 p.m. we have this quiz. I will share the link to the quiz to my Telegram group. At the end of the session, I will put it in the comments, okay? So that you all can join in, and it's free for all. So evening 6 p.m. we have the quiz, and the next day at 11 we have the session here. We have the discussion of the 10 questions. So I've already put up a schedule. So for the next 2 weeks, okay? So until next Sunday, we've got the this schedule, okay? So it runs for 2 weeks. So given the schedule, I'll share it again on YouTube also. I'll put it up as a post, and the link to the Telegram quiz, I will put it in the comment section, okay? So probably you're new to us, to join us, and I hope you're all studying well, guys. I'm so sorry I missed all of you for the last, I think we didn't have the quiz discussion or the fundus work for the last 2 weeks. I really missed you, and today I'm feeling really great, starting this again and seeing you all here, virtual presence, although it is virtual, but still it feels good with your interactions. So study well. So today evening 6 p.m. we'll have the Konya quiz, 10 questions. All right, so do well, all the best, and you're most welcome. All right. So your doom scrolling actually helped you today. Good. So it turned out to be a bloom scrolling. So, I learned this word last week because I was just resting. So bloom scrolling. So your doom scrolling turned out to be a bloom scrolling. All right, guys. So I'll see you in the discussion tomorrow, 11 a.m. All right. Bye, bache. Have a good day, all of you. Bye.